name's Revennaugh, and I agreed to this filming. I'm almost 34. I was born with a facial deformity. I had hypertelorism, which is the wide eye set, and medial cleft open throughout the middle, covered with only with skin. It was actually a pretty big cleft, missing most of my nose. Left eye socket was malformed. Never had physical problems. It wasn't a syndrome, so there was no joints involved. However, I did have very loose joints. Found that out later when I had a shoulder injury. I was a pediatric nurse at the time, and 9 months they tried to treat it. Needed surgery, but at that time I had atrophied. Everything had atrophied because I wasn't exercising. I was in pain. So I had the shoulder surgery 9 months later, but weeks after I had the shoulder surgery, all of a sudden I started having horrible low back pain. Right-sided, down the leg, sciatica, very severe pain. Went to every doctor that we could possibly find, 4 neurosurgeons, 4 neurologists, every kind of homeopathic, orthopedics, everything to try to find out what the problem was, and no one could identify what the problem was. So what they ended up having to do is rebuild this vertebrae, plates and screws, and then put in a cage and then do the bone graft. Had that in November. It was a huge success. So now basically what I came to see Al about is that I'm still having a lot of muscular pain, having nerve pain off and on, but it's obviously not a structural issue because it comes and goes, and of course with spasms it gets worse. So what I came to see him about is that I'm trying to get strong again, and because of 6 years of very little activity and not able, always major flare-ups with activity, I'm struggling to get strong again. And so in getting strong, I'm having a lot of spasms and that kind of thing. So that is where I'm at now. Huge improvement though.